I'm Dr. Brendan Kiernan. I'm one of the orthopedic surgeons here at Milford Regional. So I am a Massachusetts native. I was born and raised here, and I have a pretty large family that's all around the area. So I definitely branched out and did a little bit of my training in different regions of the country. But coming back home is it's truly an honor to get back to the area and kind of give back to the community that I know so well. I got into orthopedics in a little bit of a non-traditional way. Prior to medical school, I was involved in public health, and through those experiences, I gained some exposure to orthopedics. It was really the technical aspects that kind of drew me in, and then once I saw, patient outcomes, I realized that this really suited me personally and was a way for me to really provide the best benefit to a patient's health and well-being. When I first meet a patient, I really like to, have open communication with them. I think that's the basis of any patient-physician, relationship. And that really, opens the door to discussing goals of care, anything that is unique to the patient that might influence their outcomes. And then through shared decision-making, we can come up with the best treatment option that suits them and addresses their concerns. In addition to a lot of fracture care, I predominantly see patients with various complaints about the hip and the knee. A lot of them, have some degree of arthritis, whether that's from an old injury, an autoimmune disease, or simply genetics. But most patients will come in with some degree of arthritis, and after talking with them for a while and discussing where they are on the spectrum of mild disease versus severe advanced disease, we can come up with a plan. I think the biggest thing involved with selecting an orthopedic surgeon is really trying to find somebody who is willing to listen to their goals and their concerns. The most rewarding part of my job is really seeing patients post-operatively in clinic when I see them for the first time with a big smile on their face, getting back to the activities that they were doing a couple of years before they started having hip and knee pain, and that's certainly a nice thing to see.